And next speaker is Lisa Powell.
Thank you so much. Thank you for the lovely invitation to come here. Indeed, it is wonderful to see everyone on bikes and spending a lot of time outdoors. So I was asked to talk about the cost of childhood obesity. And in doing so, I'm really going to talk about both the costs in terms of childhood obesity and adult obesity, because of the fact that we know that children, as they grow old, obesity tracks into adulthood, and these children become adults, and even if they're not obese, there is this portion, and I'm going to try to identify that incremental impact as they become adults. So just to give you a little bit of context for the talk, I'm going to talk a number of costs at the childhood level. So there's costs associated with building up human capital. And there's costs associated directly with these medical costs and mental health. But also into adulthood, you spend a lot of time in the workplace. I'm going to talk about costs associated with absenteeism, time away from work, presenteeism, which is how effective you are when you're at work, and also wages, which is a personal loss to an individual who may be obese compared to their normal weight counterpart. So just to give you a little bit of context in terms of different countries, you can see here, if you look at the top, you'll see Sweden. I've put a red circle or oval around the United States. We compete with Mexico often for that larger spot at the bottom, with an obesity rate of roughly 1/3 of the population is obese. 2/3 are overweight. So that leaves us with 1/3 of the population, the minority of normal weight. And the reason I'm going to give you just a few numbers in terms of the US is some of the data I'm going to present in terms of costs are US, and you'll be able to sort of compare those to what are the costs of providing medical care in the absence of obesity. Here are some childhood overweight results. One of the things Boyd talked about were disparities. I'd like to really highlight this, because when we're talking about costs, if some people are more likely to be overweight or obese than others, then they are going to bear more of the burden of the cost of obesity. So this comes by gender, race and ethnicity, and also socioeconomic status. In particular, if you have a look in the US, if you look at women, you'll see there's a large difference in terms of race and ethnicity, with almost 60% of black women in the US being obese. And so if we look later on, if there are lower wages associated with obese or healthcare costs, these are going to actually increase health disparities that already exist. So it's going to further exacerbate the problems that we have. There's also regional disparities associated with obesity, with quite large rates, and you can see across the different areas, with the South being slightly more obese than some of the Western states. So costs overall in terms of medical expenditures have been going up. There was a little bit of a flattening out in the 1990s with some move to managed care and trying to control costs, but you can see that the projections just continue on this upward bound. As a percentage of GDP, you can see that the US is actually spending almost 20%, 17.5%. Actually, this number I believe I have up on the screen is about 16, but the numbers currently are about 17.5%. Many other countries with equal mortality rates, equally healthy people, are only spending 10, 11, 12%. Okay? And then as well, just to put it into perspective, and the reason I give you these numbers is that when I quote to you some numbers on the costs, you'll be able to put them into perspective. So almost $9,000 per capita in the US being spent on healthcare. So when I talk about numbers, incremental costs of additional costs of obesity up at $2,000 and $3,000 per obese person, you're going to see that that's really adding on a substantial proportion where that money could be spent elsewhere. Okay, so just in terms of some overall costs, you can see here, childhood obesity at about $14 billion per year in the US, $200 billion roughly in terms of direct medical costs for adult obesity. And then this portion, there's a nice study out that shows the incremental cost of having an obese child, and this was done among a cohort of 10-year-olds, was about $12,000. This was in addition to the fact if they were not obese and accounting for the fact that as children age, they will gain weight as they move into adulthood. So you can see here that that cost, if you add up just 1 year, it was about of 10-year-olds. So if we could just get rid of obesity in one cohort, we could save $9 billion. So a few more numbers here just in terms of comparing the overweight of children or obese children. You can see additional costs here in the $100 to $200 range. You can similarly see some numbers here as well for Germany, also find the same thing. A few other studies of costs of being as a child, what are your medical expenditures? 1.2 to 1.6 times as great if you're obese compared to non-obese. I will admit this is not a systematic review. When I was asked to do this, I did sort of go out and looked at about 20 to 30 studies. I can provide these to you if you send me an email. I'll give you my email at the end. But I just tried to give you sort of a set of examples, and you can see a pattern across different countries of finding, even at the age of children, these direct medical expenditures are already greater. So there's also a nice study that really focuses looking at obesity in terms of the different levels of obesity, grade 1, 2, and 3, with grade 3 obesity being a BMI of 40% or greater. I think this is really important to point out because in the US, obesity rate of grade 3 was at about 1 to 2%. It's now at 7%. So not only, as you can imagine, the medical, which is what I'm not covering, but the sort of the medical situation that arises in increased health risks and poor health outcomes. But here you can see what the costs are. So $1,000 to $2,000 more. So putting that back into the context, if you're spending $8,000, $9,000, you're really talking about over 20% additional costs related just in terms of direct medical expenditures, and we haven't even started to talk about the rest of the costs. Another area to think about, one often thinks of direct medical costs, but there's a number of studies that are focused on mental health issues among youth. There's a nice study that looks at suicide ideation. Suicide attempts tend to be larger. There is mixed evidence, but it does tend to be larger and more impact among female adolescents. For adults, the studies show more mixed results, although suicide attempts actually are higher for adult women. There are also an interesting study that looked at more smoking among girls. Younger boys tend to be more bullied. Older boys in the study were found to be more likely to carry a weapon. So you're maybe bullied as a younger boy, and then as an obese older boy, you're carrying a weapon to perhaps defend the bullies, or yourself against the bullies. And so again, perception of overweight is particularly important, especially among females and their mental health. So human capital accumulation. So as I'm going to talk in a little bit, there are differences once you become an adult. But as you move on that trajectory, one study in Germany found that cognitive skills, motor skills, verbal skills were affected even as young as 2 to 3 years of age. Absenteeism at school is about an extra 2 days on average for obese children compared to their non-obese counterparts. And you can see another study found that GPA was lower. So if your GPA is lower, your grade point average, as a high schooler, that's going to affect where you go at the next level, whether you get into university or not, or what university you go to, what field you might pick to go into. And so that's also going to track and independently potentially affect wages. So then what about when you become an adult? Here we have costs associated with presenteeism, absenteeism. You can see here number of days missed at work are greater if you're an obese adult. Absenteeism costs. Those studies, I've listed 3 different studies, and the sources are on the bottom. They range because some of the years differ. It's also important to point out that some studies do a better job in addressing causation, or are these sometimes unobserved differences, and depending on the data set, it's hard to get at this. Presenteeism, though, and I'm going to show this to you in a graph in a moment, is actually substantially larger. So that last number of $12 billion per year, the same study found that presenteeism was costing roughly $30 billion per year. And disability is 1.3 to 1.8 times more likely short-term disability for obese workers. So again, here are the numbers in the Finkelstein paper, just broken down in terms of the grade of obesity, but you can see now we're talking about, on top of the medical costs for grade 3 obesity of $2,000 per year, add another $1,000 for absenteeism, and roughly for women, for example, $3,000 for grade 3 obesity. And just here it is in a picture. And I think this really speaks to the fact that on average, for every individual, we're spending in the US $8,000 to $9,000 in medical expenditures. If you add up these costs and you stack them, I just took the numbers that they had in the study and just put it into a graph here, you can really see, and if you've got 7% of your population at grade 3 obesity, you can really see that these costs are starting to stack up. So obesity and wages. There are a number, labor economists do a number of studies looking at different factors affecting wages. You think about your wage is supposed to reflect your marginal productivity of the time in the workplace, so education, experience go into this. And you can see that in the US, for men, the penalty, we could sort of think about it as the wage penalty of obesity is about 1% to 3%. For women, it's 2% to 6%. A recent study showed that if you were 2 standard deviations greater than the mean in terms of your body mass index as a woman, you were going to receive roughly 9% lower wages. The wage penalty in the US is found to be greater for women, but in Europe there was really a study that showed that there was not actually a statistically significant difference. Wage penalties tend to be found more in white-collar jobs and jobs requiring interpersonal communications and skills, which is not surprising. So finally, another area when I was looking into what some of these costs are, there's a large literature actually in the transportation literature on environmental costs. I mean, there's other types of environmental costs, but I think for transportation, quite a few studies came up looking at costs in terms of road transport. You can see here about $2 billion in additional gasoline estimated CO2 emissions. So I think if we get groups starting to work together, and this was just alluded to, that we make this both a health and an environmental issue, we can maybe bring some more pressure to bear on our politicians. Also, just one other study, for example, in terms of jet fuel costs being increased. So I've thrown a lot of numbers at you. You can send me an email, I can send you the papers. And I just thought, as I had put these slides together, I thought, well, geez, there's a lot of numbers. Like, how can we think about this coming together? And I think this graphic hopefully helps to do that. So childhood obesity is associated with a number of direct costs itself in terms of medical costs, costs in terms of the accumulation of human capital while you're still a child, poor mental health, obviously the physical health, school acquisition, school time, delayed skills, lower test results. As an adult, there are direct costs, again, the same types of physical and mental health costs, the medical costs associated with that, presenteeism, absenteeism, the wages we talked about, and environmental costs. Childhood obesity itself tracks into adult obesity, and independently, if you have lower skill acquisition, you're by definition going to have lower wages as well. All of these things lead to lower utility, the word that economists just really say for how happy are you, what's your total utility. And I think quite importantly, this is going to lead to increased health and well-being disparities. Health disparities through the direct impact on health, well-being disparities because of the socioeconomic impacts related to lower wages, and increased healthcare costs. Not so much an issue on the increased healthcare costs if you live in Canada where health is free, or in Sweden, or if you have the British National Health System, but in the US, you pay a portion of healthcare costs through deductibles, co-insurance. So if you're using much more, if you're spending thousands of dollars per year more, you're going to be spending more money directly in terms of covering your healthcare costs. And all of this is moderated by your socioeconomic status, your gender, your race, and your ethnicity, both directly in terms of its impact on differential rates for obesity, both in childhood and as an adult, but also in terms of some of the evidence that I showed you, where we saw that, for example, the return on wages and the impact related to obesity is different depending on whether you're a male or a female, or potentially what your ethnicity is. So I think that's particularly important as we think about addressing these. We're talking about health and well-being, and also potential increased disparities. So I think what's really wonderful about this particular summit is that it's really bringing us to the point of, well, what the rest of these workshops are on actions. What can we actually do? How can we get this moving? And I really like this slide from the CDC, because what Centers for Disease Control and Prevention in the US, because it talks about different types of factors. And even at the bottom, I think stressing the socioeconomic factors relates, again, to making sure that we're constantly aware of the fact that different groups are differentially affected, and sometimes we can actually change outcomes by changing the socioeconomic status of individuals, but changing the context. So my real area, and I'm going to talk about that later in the workshop, is on sugar-sweetened beverage taxes as an economist. And taxes have an advantage of having broad population reach. If I wanted to reach all of you, I could just slap a tax on you and on average change your behavior by a certain amount. But if I were to use education, for example, I'd have to go table to table and talk to each person individually, or perhaps put you into groups. So I think using the spectrum and seeing how these different types of policies can be complementary is particularly important. There's no one of them is going to solve the problem, and using them together is particularly important. So I look forward to the dialogue that will happen at this summit, and I thank you for the invitation. And here's my email if you'd like to contact me.